Every day, dentists must make ethical decisions to promote the health of their patients. But what exactly does being ethical mean? Ethics is defined by the ADA as the combination of 5 basic principles. These 5 are 1. Patient autonomy, 2. Non-maleficence, 3. Beneficence, 4. Justice, and 5. Veracity. Today we'll be focusing on non-maleficence. Non-maleficence is the idea of doing no harm. This means that the dentist must keep their education up to date, will seek consultation and referrals when necessary, have qualified auxiliary personnel, and will not practice when impaired. To give an example of these concepts, we will follow the life of Dr. Jones. 2 years ago, Dr. Jones had it all. He had a beautiful wife, 2 perfect children, and his practice was flourishing. But things took a turn for the worse when last year his parents passed away, his wife divorced him, taking all of his money and his kids. And to get through the days, he has become increasingly dependent on alcohol. Today, a patient came in complaining of pain in her lower right quadrant. Rather than diagnosing the patient and coming up with a treatment plan, Dr. Jones asked his dental assistant to talk to the patient and find out what's wrong. The assistant determines that the patient probably needs a root canal for tooth number 30. Although Dr. Jones has not done a root canal since dental school, he decides that he will perform the treatment anyways, because he's been struggling to make ends meet after his wife took his money. He has had a few drinks already, but doesn't think twice about performing the procedure that day. So what's wrong with this scenario? First, Dr. Jones asks his dental assistant to evaluate the patient. The dental assistant has not gone to dental school and is unqualified to make any form of assessment on the patient. Dr. Jones should have been the one to meet with the patient to determine a diagnosis and treatment plan. Second, Dr. Jones has not kept his education on root canals up to date and should have referred his patient to either another dentist who does root canals or an endodontist. He especially should not have taken the case purely to make money off of the patient. Third, Dr. Jones should not be practicing under the influence of any kind of controlled substance, including alcohol. Just like drinking and driving, this is illegal, unethical, and dangerous for the patient, and would result in Dr. Jones losing his practicing license. By allowing the scenario we just talked about to happen, Dr. Jones is harming the patient and in direct violation of the ethical principle of non-maleficence. So what have we learned? Non-maleficence is the dentist's duty to refrain from harming the patient. They can do this by keeping their education up to date, seeking consultation, and giving referrals when appropriate. Having auxiliary personnel that only performs duties they are qualified to do, supervising all patient care from beginning to end, and not practicing under personal impairment. Dentists are expected to hold high ethical standards in order to ensure that their patients' health and benefit is the #1 priority. Thanks for watching! We hope you learned a little bit more about ethics and non-maleficence today. The end. This animation was brought to you by April Kwan and Alex McCollum.